In this video, we're going to discuss the actual equipment itself, what the functions of each component are, and how the gas paths are through the system, so maybe you have a better understanding of how the machine works. The starting point is the oxygen supply pressure coming into the base of the flow meter. You have a 50 psi of regulated pressure entering the machine. The flow control valve is a needle valve. In the off position, there's no flow. As you open the needle valve counterclockwise, it allows that 50 psi of oxygen pressure to pass through the needle valve and actually rise the ball based on how much flow you're allowing to be delivered through that valve. When the flow exits the flow meter here, it goes to the input side of the vaporizer. In the off position, the oxygen actually just travels through the manifold back out through the block and to your patient as straight oxygen. With the vaporizer in the on position, the oxygen is diverted then down through the wick material and it picks up the molecules of drug, and then this is the output hose from the vaporizer. This then goes to the patient. This is the inspiratory side of the circuit, and this is the expiratory side of the circuit. There are one-way check valves here that allow flow to travel in only one direction. So the gases, after they're mixed, the fresh gas comes through the inspiratory valve. Patient draws a breath, this valve opens, it delivers the breath to the patient. The patient exhales, this valve closes and seals, and the expiratory valve opens, and the patient exhales through the expiratory valve. The first part of the exhale breath will actually refill the breathing bag, because a lot of that gas is not taken up into the body. The exhale breath at the beginning is mostly oxygen and isoflurane. And as the bag refills and builds pressure, then the remaining portion of the exhale breath actually goes out the pop-off valve or APL valve to your scavenging system. That's the part of the breath, the last of the exhalation phase actually has mostly CO2. Then as your patient draws its next breath, what the exhale breath that's now in the bag is drawn through the CO2 absorbent, which scrubs any CO2 that was present, and it goes back to the patient then with oxygen, isoflurane, and the fresh gas that's being added from the mixture that we've dialed in. So there's some recycling going on at the same time there's fresh gas being added going to the patient.